Mpox, also known as monkeypox, is a viral disease. It was first discovered in 1958 in monkeys. The first human case was recorded in 1970 in the Democratic Republic of Congo. Since then, it has spread to many countries, mainly in Central and West Africa. Mpox is part of the same family of viruses as smallpox. However, it is not as severe. The virus can infect both humans and animals. It is called monkeypox because it was first found in monkeys, but it can also infect rodents and other animals. In recent years, there have been more cases of Mpox. This is due to several factors, including increased travel and climate change. Understanding Mpox is important for preventing its spread. Knowing the basics can help protect you and your community. Mpox is a serious disease, but it can be managed. With proper knowledge and precautions, you can reduce your risk of infection. This essay will explain what Mpox is, its symptoms, how it spreads, and how to protect yourself. Mpox symptoms can appear 5 to 21 days after exposure. The illness usually starts with fever. Patients often feel tired and have headaches. Muscle aches are also common. These initial symptoms are similar to many other viral infections. After a few days, a rash appears. The rash often starts on the face and then spreads to other parts of the body. It can also affect the palms of the hands and soles of the feet. The rash looks like blisters or pimples. These blisters fill with fluid and then crust over. The rash can be very itchy and uncomfortable. It usually lasts for 2 to 4 weeks. In some cases, the rash can leave scars. Other symptoms can include swollen lymph nodes. This is a key feature that helps doctors differentiate Mpox from other diseases like chickenpox. It's important to seek medical help if you have these symptoms. Early diagnosis can help manage the disease better. It can also prevent the spread of the virus to others. Mpox spreads in several ways. The most common way is through direct contact with an infected animal. This can happen if you are bitten or scratched. Handling animals or eating undercooked meat can also spread the virus. The virus can also spread from person to person. This happens through close contact with an infected person's rash. It can also spread through respiratory droplets. This means that coughing or sneezing can transmit the virus. Sharing contaminated objects like bedding or towels can also spread Mpox. In healthcare settings, the virus can spread if proper precautions are not taken. Doctors and nurses must use protective equipment. This helps to prevent the virus from spreading to other patients or staff. Preventing the spread of Mpox requires careful hygiene. Washing hands regularly and avoiding contact with infected animals are key steps. Using protective gear in healthcare settings is also essential. As of September 2024, Mpox cases have been reported in over 40 countries. The highest numbers are in Central and West Africa. Nigeria and the Democratic Republic of Congo are the most affected. In these regions, Mpox is considered endemic, meaning it occurs regularly. In the last year, there were over 6,000 reported cases globally. This is a significant increase from previous years. In the United States, there have been about 200 cases. Europe has also seen a rise in cases with over 500 reported. Several factors contribute to the increase in cases. These include more frequent travel and changes in land use. Climate change is also a factor. It affects animal populations and their habitats. This increases the chances of humans coming into contact with infected animals. Public health authorities are monitoring the situation closely. They are working to control the spread of the virus. Efforts include vaccination campaigns and public awareness programs. Section 5. Practical advice for prevention. Preventing Mpox requires simple but effective measures. First, avoid contact with animals that could be infected. This includes monkeys, rodents, and other wildlife. If you must handle animals, wear protective clothing and gloves. Good hygiene is crucial. Wash your hands frequently with soap and water. Avoid touching your face, especially your eyes, nose, and mouth. Clean and disinfect surfaces regularly, especially in healthcare settings. Vaccination is another important step. The smallpox vaccine can also protect against Mpox. If you are at high risk, consider getting vaccinated. Talk to your doctor about your options. Lastly, stay informed. Follow updates from reliable sources like the World Health Organization and the Centers for Disease Control and Prevention. They provide the latest information and guidelines on Mpox. Section 6. Importance of credible information. Staying informed is essential for preventing Mpox. Misinformation can lead to panic and improper prevention measures. Always seek information from credible sources. These include health organizations like WHO and CDC. Social media can spread false information quickly. Be cautious about what you read online. Verify facts before sharing them. Look for updates from trusted news outlets and health authorities. Doctors and healthcare providers are also reliable sources of information. If you have questions, don't hesitate to ask a medical professional. They can provide accurate and up-to-date advice. Education is key to controlling the spread of Mpox. Informing your community can help everyone take the right precautions. Share information from credible sources and encourage others to do the same. Section 7. Summary and key points. Mpox is a viral disease that can affect both humans and animals. It was first discovered in monkeys, but can also infect rodents. Symptoms include fever, headache, muscle aches, and a rash. The rash is a key feature and can be very itchy. The virus spreads through the direct contact with infected animals or people. It can also spread through respiratory droplets. Recent statistics show a rise in cases globally, especially in Africa, the United States, and Europe. Preventing Mpox involves good hygiene and avoiding contact with potential carriers. Vaccination is also an effective way to protect yourself. Staying informed through credible sources is crucial. Understanding Mpox and taking proper precautions can help control its spread. Early diagnosis and treatment are important for managing the disease. Section 8. Hopeful outlook on research and prevention. There is ongoing research to better understand Mpox. Scientists are studying the virus to develop more effective treatments. New vaccines are also being tested. These efforts aim to reduce the impact of Mpox globally. Public health campaigns are raising awareness about Mpox. These campaigns educate people on how to protect themselves. They also provide information on what to do if you are infected. International cooperation is key to fighting Mpox. Countries are working together to share information and resources. This helps in tracking the spread of the virus and implementing control measures. The future looks promising. With continued research and public health efforts, we can hope to control and eventually eliminate Mpox. Until then, taking preventive measures and staying informed are our best defenses.